Okay, you can. Welcome to my informative speech. The purpose I chose was to talk about how it is, what it is to be living in a pandemic, and what is COVID-19 to us. Um, Starting a new decade off with a pandemic is quite crazy, right? Who would have thought we would be living in a pandemic in year 2020 when it had just started? This crazy sickness is called coronavirus, which many people know it as COVID-19. Coronavirus is a family of viruses that can cause illness such as the common cold, acute respiratory syndrome, and Middle East respiratory syndrome. It originally came from China. So now that we have a little bit of information about what I'm going to speak about, we can go into more detail about how it all happened in 2020. So COVID-19 affected everyone in many ways, as many people went unemployed, many people lost their jobs, many people ran out of businesses. We all had to use face coverings. Everybody had to be like in social distancing. Being in a pandemic isn't fun at all. Many people have lost a lot of loved ones due to this terrible sickness, and many healthcare workers got worked so much to help fight against COVID. COVID to us is very deadly in many ways. It's a virus that can be transmitted so easily by just by somebody carrying it, and you don't even know if you're carrying the virus. Okay, so now that we have a little more understanding of what the pandemic was and what it is, because we're still living in it, we can go more into detail about what symptoms COVID gives us, and how do you know if you have COVID, and what can happen after getting COVID. So the signs and symptoms of COVID-19 may appear from 2 to 14 days after you've been exposed. The time after exposure and before symptoms, is called the incubation period. Common signs and symptoms can include cough, shortness of breath, tenderness, muscle aches. Early symptoms of COVID can cause shortness of breath, or like small headaches, or maybe a cough. It is very similar to the flu, so a lot of people can get it confused. Usually in December, November, we hit flu season, and this time around we only had like maybe 2 flu patients, because COVID obviously took over the flu people. The severity of COVID-19 symptoms can range from very mild to severe. Some people may have only a few symptoms, and some others might experience very bad symptoms, or there's some that don't have symptoms at all, which those people are not infectious, only the people that have actual symptoms. Some people may experience worse symptoms. The worst one is shortness of breath, and then the body aches, and then after this can lead up to pneumonia, and it can lead up to like liver failure, and a lot of other things. Also, for most patients that die from COVID are that die from COVID are with sepsis. Majority of them go into respiratory failure. A lot of them have acute respiratory already distress. And as it states in the internet, if you have any type of underlying illnesses, you're already at a bigger risk than anybody else, because your immune system is already trying to fight other viruses off, so your body's already compromised to fight off a disease. Sadly, COVID attacks the elderly harder, and then the people between 50 and 60 years old. Most of these patients can't breathe good. Majority of the time they get intubated to help relax their lungs and help them breathe help the machine pretty much breathes for them and helps them relax, so they're completely like sedated, so they won't feel anything. So pretty much the machine does all the work for the patient in the time being until the patient can start doing some work on his own. Living in a pandemic is definitely not easy, especially when you are restricted to go to certain places or what you can actually do. It's very unbelievable that how the sickness affected everyone's lives in different ways. How many people had to wait in big lines outside a grocery store just to be able to get in, and some people would wait for like maybe hours. And sometimes once you would get into the store, since everything was backed up from COVID, there would be nothing on the shelves. And a lot of people freaked out about COVID, obviously, because it's a deadly virus. And a lot of people would gather a lot of food from the stores and wouldn't think about the other people. So that's why we went into like shortage of a lot of food. A lot of people ran out of businesses due to COVID because obviously they had no business and they couldn't get shipment. Millions of people died from COVID in a little bit of time. Many people come in and they can come in speaking, and then they die in like maybe some days or something, and COVID is very unexplainable. Okay, so now that we have learned a little bit about COVID-19, we can go on to a closing about it. In conclusion, as my own being a healthcare worker, COVID-19 is definitely something to take very seriously, because I have seen so many things in the hospital that have left you mind blown to what your body can take and what COVID-19 can do to your body. As living in a pandemic isn't fun. Keep wearing your mask, even if the governor said that you don't have to wear a mask anymore, and I would still keep your distance. COVID is not a joke, and it's still not over. If you haven't got vaccinated and you can get vaccinated, I would recommend for you to get vaccinated, especially for the ones over 50 years old, because it has helped decrease COVID patients in the hospital right now. We're down to only one COVID patient on the ICU. And also the vaccine has helped a lot with the cases to come down, such as in death or such as in just having COVID in general. So my citations is from Mayo Clinic, and then my other citations is from drugs.com. And that pretty much concludes my speech. Thank you.